Hello there. When a nurse or a technician fails to properly put in an IV and administers the medication into the wrong place, it can cause a host of issues, including even amputation. Today, we're going to be talking about IV infiltration. Infiltration from an IV means when the IV goes in, but it's not in the actual vein or artery that it needs to be in. When that happens, the medication is then released, and it is released into the tissue area as opposed to in the bloodstream. Certain medications can eat away at tissue. And when that begins to happen, obviously, there is quite a big issue here. For example, one of the things that needs to be done is a flush of the tissue from that medication. That could very well not be easily done. Sometimes surgery is required, and sometimes it gets so bad that an amputation is required because the tissue has gotten to the point where it is too far off dead for it to survive. IV infiltration can be avoided, though. A lot of ways that it ends up happening is usually because the nurse or the technician fails to actually detect whether they're in the vein. You probably have heard of a pullback before, but it's essentially when the IV goes in, they pull back just a little bit to make sure that some blood actually goes into the medication in the syringe, and then they push the whole medication into the vein. That can be sometimes forgotten to be done, and therefore they don't know that they're not in the vein. Another way is when you stick somebody and you can't really see the vein very well, whether it's because the patient might be obese or just doesn't have great veins. You may need to use some sort of guidance system, such as an ultrasound. Nowadays, the equipment in medicine is so advanced that not finding a vein is really something that is a never event. It's almost something that never happens anymore. It should always be found no matter what. Therefore, IV infiltration is typically something that's done only if there is absolute negligence. If you or a loved one suffered from an amputation due to IV infiltration, then you need to speak to a medical malpractice lawyer to talk about your rights. My name is Adam Funk, and I am a medical malpractice lawyer, and I'd be happy to chat with you about your case.